Welcome to Shape Cosmetic Surgery. I'm Dr. Sharma. I just wanted to go over some of the risks and complications in general. Obviously, afterwards, you'll have plenty of time to speak to me regarding any questions and concerns that you have, but I just wanted to give a short introduction to the risks of the procedures. We have checked your blood work and everything seems to be in order. That's why we are proceeding. The chance of infection with our procedure is less than 1% with liposuction. If you're having a fat transfer, the fat transfer has approximately a 5% chance of causing an infection. If you get an infection, you will need IV antibiotics and you may be admitted to the hospital. We have some methods that we can use to minimize that risk. We would like you to finish your antibiotics completely. As well, we would like you to avoid taking any baths, hot tubs, saunas, dipping in any kind of water or liquid for approximately 1 month, okay? Chance of bleeding with this procedure is less than 1% having major bleeding. We would like you to not take any aspirin or any kind of blood thinners during this process. Please inform us if you have taken any. The chance of getting a seroma with our procedure is less than 3%. If you wear the garment that we have provided, you will not get a seroma. Granted, if you take the garment off and don't wear it as we have told you, there's a high likelihood that you will get a seroma, in which case we would have to drain the fluid and replace the garment. So, moral of the story is wear the garment. The chance of not getting enough blood flow to your tissue is only happens. This is called skin necrosis. This only happens in chain smokers or people that do smoke. We would like you to not smoke, or to, if you are a smoker, to have stopped smoking approximately 1 week prior to the procedure and for 2 weeks after the procedure. If you're on any steroids, you have an increased chance of having some delayed healing. As long as you're not on steroids, we expect you to have a normal course. The chance of getting a blood clot in your legs is a real phenomenon. It's called a deep venous thrombosis, the medical term for it. It's approximately 7% in the general population. How do we limit it? Well, in our operating room, we employ compression socks, SCD boots, and at home, we would like you to walk as soon as possible after the procedure. While you're watching TV, we'd like you to pump your calves. We would like you to avoid any air travel for 7 to 14 days, and so that should minimize the risk. If you do have a history of blood clot in your family, please do tell me or the staff. The things that are 100% with any procedure that I do, there will be a 100% chance of having swelling, 100% chance of having bruising. There will also be a 100% chance of having pain or discomfort after the procedure. Now, how do we deal with these? I will prescribe one prescription for narcotics after the procedure to help you deal with the pain during that first week. I would like you to wean off of the narcotic after the second day and start using ibuprofen to help reduce your pain during the day, and then at nighttime you can take the narcotic to make you a little bit more comfortable and get some sleep. The bruising takes about 2 weeks to fully go away. We do recommend using arnica to help with the bruising. Swelling, there's a 100% chance of that happening. The swelling takes approximately 3 weeks for 70% of it to go away, 3 months, 100% gone. Scarring. The incisions are very tiny with your liposuction procedure. If you do keloid, there's a possibility that you may keloid, in which case we would have to use steroids to help with the keloid scar. You're definitely 100% chance of having numbness in the area after the liposuction procedure, in the area that we liposuction. You may have some tingling as well. This takes approximately 6 months to resolve fully. Your right and left side, if we're doing a fat transfer, are not going to be 100% identical. There will be a slight asymmetry between the two sides. There will be scar tissue that forms under the skin, and it will improve and heal over the period of approximately 12 months. If your BMI is greater than 32, our anesthesiologist will have to give you a little bit of extra medication to keep you comfortable during the procedure. Because of that medication, you will expect to spend approximately a little bit extra time in recovery for that medication to wear off. Now, with any procedure, the long-term results are uncertain. As long as you stay within 20 pounds of your preoperative weight, the fat removal is permanent from that area. If you were to get pregnant or to gain an extraordinary amount of weight, the cosmetic results will go away. I do like to discuss that there's a possibility of death with any surgery. It's rare. It's a very rare complication. I want you to be honest with me about your health history so that I can make the best decision for you and whether or not to do the procedure at all. In addition, there are some unusual allergic reactions that you can have either to the garment or to the cleaning solution that we have, or something that you're allergic to that you don't know of, and neither do I know of. If that happens, we'll deal with it. As far as I would like to discuss that you have been shown pictures of my work, and we are going to go over what you can reasonably expect with your procedure. This is not a weight loss procedure. This is a contouring procedure as defined by the government. This is an elective procedure, not a life-saving operation. You don't have to have it done, and it's not going to solve any personal problems or relationship problems. Getting this done will not make anyone love you more or less. This is something that you should do for yourself. I hope you got a brief introduction into what the risks and complications of the procedure are, and I look forward to speaking to you in person afterwards and answering any questions that you have. See you soon.